Thank you. Thank you very much. Assalamu alaikum. First of all, I would like to thank the organizers, my dear friend who invited me and gave me this opportunity to speak and interact with my Turkish friends. This is my 5th visit to Istanbul in this year, so you can imagine how much I like Turkey. So I'm going to speak on patient-centric digital health and mobile health and the opportunities and trends. So before I start on that, this is a little bit of my background. I'm a medical doctor, but I don't practice anymore. But I work in healthcare, essentially in technology. So as you know, I'm from Pakistan. And so Pakistan is a country with diversity. We have the #2 highest mountain in the world. We have different kind of landscapes, one of the largest deserts, one of the oldest civilizations, and obviously Karachi, where I come from, which is one of the probably 5th largest city in the world. And obviously, as we all know, Pakistan and Turkey have been very close friends for a very, very long time, and the friendship is still going strong. So just wanted to stress on that, and you can imagine how glad I am to be speaking in front of you today. So my presentation today will be covering these areas. And as you know that I'm a physician, so I'll be covering more of the healthcare side as well. As we were discussing just now with David, that in technology conferences, we tend to forget the healthcare aspect. So before I start, if I can have a show of hands, how many physicians, doctors do we have here? Okay, so as expected, how many from the IT industry? Not the telecom industry, IT, okay. How many from the pharma industry? Great. So we have a mix of IT guys, telecom operators, right? How many? Yeah, so pretty much the same. So it's a very good mix of audience. And my presentation actually covers all. So first, let's establish our direction. We do not exist, no conference, no presentation, no Dr. Zaki, if our focus is not patient-focused, or if we don't think that the patient is the ultimate beneficiary of all what we are doing. Because if we don't, then we'll be following the path of so many people who have failed in the past and who are going to fail in the future. Because I'm going to establish that healthcare is different. Healthcare is like food. We all need it. It's not like a computer. Even it's not like a mobile. We all need it, and we continuously need it. It's very complex. It's essentially reactive. Something happens to me, then a patient comes to a doctor. We are trying to make it more proactive, but still it essentially is reactive. And obviously it's time-bound. I have angina. I need intervention within the first hour. If you give me an appointment 5 hours later or on Monday, you're not helping me. I need it right now. So let's look at this. This is a very important slide which I wanted to share before we moved on to some examples and technology. So this is the paradigm is shifting in healthcare. And this is what the future is going to look like around these areas. Number one, this is my personal area of interest, which is telemedicine. And now it has gone to the mobile. So we are now, in the US, we have around 25 programs which are up and running and providing telemedicine through mobiles. So web and mobile-based teleconsultation, hospital to home care. It is nearly impossible to sustain a tertiary care center in the future in healthcare. So the shift is already happening. Patients are going to be in home, especially the patients with non-communicable diseases and diabetes or other diseases. So that shift actually is also going to shape our technology and our business. Wearable sensors probably already there, but now we are moving toward insidables. So I'm not only wearing something outside my body, I'm wearing something inside my body, and that's an exceptional opportunity. Mobile apps, as we all know, the numbers are staggering. I'm going to show you some numbers, and the last slide will supplement that. Very interesting. Personalized medicine. We already have drugs approved by FDA for the same disease, but for 2 different patients based on their, genetic predisposition. Social media, my friend Lance, spoke, elaborately upon that. Health portals and personal health records. I'm going to link that with, patient-centric and empowered patient. Webinars and video. We are all moving towards video. Even today's session is being streamed, as we know, and maybe it's going to be archived and then become a video portal where others who are not here can look at. And we are using it already in, CMEs. Big data, again, it's a gold mine. We have a lot of conferences. I was in a conference last month in Arab Health. I'm going to speak again. Any healthcare conference, you'll see big data as one of the sessions. And 3D printing. Even though I try to remain at the cutting edge, but this area has actually, it's just the development is again staggering. It's going at a very high pace. So look at this in the future. So these are the areas. If you're in healthcare, follow these areas and try to position yourself in one, a few, or if not all. So Lucian is a professor emeritus at Harvard, and he was the kind of a founder of patient safety movement in the US. And he said that modern healthcare is the most complex human activity there is. And I have mentioned this. Why? Because that is why we are constantly failing or not succeeding as we should have in our healthcare interventions and projects, although we are spending a lot of money investing huge investments in healthcare projects, but we're not really getting there. Why? Because it's extremely complex. So for a telecom operator or IT industry or pharmaceutical industry, if we do not understand healthcare, I'm afraid that our projects and our programs and our activities and interventions are not going to be effective as they should be. So this is the dynamics we are up against today. The disease burden, as we all know, has shifted from infectious disease to non-communicable disease. And this is a major problem. Infections, I take antibiotics, I am free. In 1 week, I'm off. Diabetes for the rest of my life. Heart disease for the rest of my life, and so on and so forth. So the disease burden has increased. The cost, again, it is unsustainable for any system in the world to actually manage the costs which are, skyrocketing. Medical errors, I'm going to speak about that in a little while, and the maybe century-old issue of healthcare. We all work in silos. Physicians, healthcare professionals, we love to work in our silos. If I'm a surgeon, I'm not going to talk to the pathologist. If I'm a physician, I don't talk to the nurse. So silos is a disease for us. But then there are 2 opportunities. One is technology, and the other is patient empowerment. And that's how I'm going to link these 3-4 areas together for all of you to leverage and capitalize upon in your specific areas, as we have done. So non-communicable disease, a web. We all are now, we are stuck in this web. 7 of the top 10 causes of death in 2000 were chronic disease. These 4 diseases, in addition to mental illness, are going to cost us $21 trillion in the next 5 years. So anyone knows the answer to this question? What is the 3rd leading cause of death in the US in 2015? Yeah. Yeah. So you're close. It's medical errors, including adverse drug reaction. Imagine what we are doing. So it's not, diabetes. It's not a disease. It's something which we are doing within the system. It has become an official 3rd leading cause of death in the US after cancer and heart disease. So Hippocrates said this a long time ago. If you cannot help a patient, please at least do no harm. At least. And we have forgotten that. So, To Err is Human is a document. I'm sure, most of you are aware of this document. This created an uproar, shook the healthcare industry in the US in 1998 when this document came out. thanks to the contributions of Professor Lucian and so many others. And it's said that 44,000 to 98,000 people die every year because of medical errors. Obviously, the healthcare professionals did not like it, and they said, okay, how is it possible? But after a year, they realized that that number actually is not correct. And the number is more than 400,000 per year. So much so that Wall Street Journal goes to say that 4 jets, equivalent to 4 jets, we are killing patients or harming patients. Imagine a jet goes down, the whole world knows about it and we talk about it. In healthcare, so many people are dying every week, and we're not doing anything about it. So WHO goes to say that 1 in 10 patients are harmed in our Johns Hopkins, our top-of-the-line hospitals to rural areas. Healthcare is harming patients. We all know which country we are talking about, right? Top $3 trillion industry, top hospitals, top research, top physicians. Everything is the top, #1 in the world. Yet, US is not ranked in the top as a top #1 healthcare system or in the top 10. So there must be something which is significantly wrong and missing in healthcare. And that is what I wanted to address today, that as business professionals, as pharmaceutical professionals, it is not only necessary to understand the business models, but please understand healthcare, because healthcare is different. And one of my hats is that I'm an embedded consultant to a leading pharmaceutical company heading their digital health space, helping them to develop their interventions. And that's what I tell my team, that first understand healthcare, then embark upon these projects. So after To Err is Human, a new document came out, Crossing the Quality Chasm, and for the first time it mentioned patient-centric healthcare as fundamentals of healthcare. So these are the new fundamentals of healthcare, where patient centricity came out as one of the strong factors. And then the rules changed, and then we got new rules. And the most important, which I've marked in red, is that the patient is the source of control. Previously, or even today, unfortunately, the source of control is physicians, right? Physicians are next to God. They enjoy the control, they enjoy the power, and they are not ready to give it up. And that's one of the main hindrances in healthcare. So WHO, again, is very focused on patient-centric healthcare, defines it. It's people-centric, looking at not the disease, but the people. Who understands the difference between a disease and an illness? What is the difference between a disease and an illness? Okay, so disease, maybe how many people in the hall have hypertension, high blood pressure? 1, 2, 3, 4, 5. So I have hypertension. So we all have the same disease. But my hypertension causes headaches, but your hypertension causes maybe weakness. So your illness is different, but we all share the same disease. Patient-centric healthcare is about treating the illness, not the disease. And that's why we have personalized medicine, where even diabetes is going to be treated by 2 different drugs if your genetic predisposition is different. So this is very important, that we need to differentiate between disease and illness. So from a disease or a doctor-centric healthcare perspective, we need to shift to a patient-centric healthcare perspective, whether we are physicians or whether we are telecom operators, whether we are Vodafone, whether we are Novartis. We need to have this focus. Otherwise, our investments, our projects, our interventions, obviously they will have some level of benefit, but they're not going to be efficient, effective, and sustainable. Maybe after 2 years, we started one of the oldest medical call center in Pakistan 7 years ago. It was probably the 4th or the 5th in the world with Telenor. Huge investments from Telenor. After a few years, the whole team changed and the commitment went down, and we were just like, we invested a lot of money as well. Hundreds of thousands of patients benefited, but then the focus changed. So because they were not cognizant about the healthcare dynamics so much. So the new era of patient engagement is the blockbuster drug of the century is not a drug, it's a concept of patient engagement, especially for my friends who are from the pharmaceutical industry. Don't wait for a blockbuster drug. The drug is already here in the form of a concept. This was said by Suzanne, and I love this quote. So empowered patients are, they want to decide or be part of the decision. So no decision about me without me. They want to be part of the decision-making process. They want to be responsible, ability to respond, right? So they are more informed. They go to the internet, and we are going to see some information, statistics, and they want to collaborate now. So one of the patient portals, Patients Like Me. How many have heard about this? Patients Like Me. Probably one of the largest in the world, right? So if you go to that, and there are many others, you will see that patients are collaborating with each other. They're not only collaborating with each other, but they want to collaborate with their healthcare professionals, or even the pharmaceutical, as I will show you. Anyone knows this guy? Okay, 1, 2, great, 3, 4. This is a very good number. I speak in conferences nearly every month, and I don't get a very good response on this slide normally. So this is Jack from the US. He was a high school student. His uncle died of pancreatic cancer, but he did something different from all of us. He started thinking. He asked the question that, why did my uncle die in this age where cancer is pretty much, treatable? So the answer came that pancreatic cancer is diagnosed very late. Yes, we all agree as healthcare professionals. So he said, okay, fine, why? So the why question, and then as a high school student, right? Not a medical student, not even a science student, high school student, leveraged upon these two, Google and Wikipedia. That's it. He started his research from these two resources, and eventually, long story short, eventually came up with a test through which you can detect pancreatic cancer as well as some other cancers, although it's not FDA approved yet, but it's in the process. But he showed that patients can be so empowered because of the revolution of technology and the plethora of information on the internet that they, even though they're not scientists or physicians, they can still, make a difference in healthcare. So if you look at Medline, which was probably only for doctors, it changed. And it is estimated that about 30% of Medline searches are by members of the general public and students, which something which was only, dedicated for the physicians or used by physicians now is being used by the general public and the patients. Patients are on the internet. They are on the lookout. Anyone knows this guy? Amazing guy. Had cancer, started a movement, fought his cancer. He created history by becoming the first non-physician as a visiting professor at Mayo. You all know Mayo Clinic, very prestigious institution of the US. Patient engagement empowerment is a natural extension of Dr. Will Mayo's vision, and Dave became the first non-physician to become a visiting professor at Mayo. Look at the power of engaged, empowered patient. So the opportunity is technology is creating empowered patients in a patient-centric healthcare ecosystem. Anyone has seen this? So we live in a world, great. We live in a world where we talk about these, flexible TVs and everything, right? So it's easy to envisage the future because we're already seeing something unbelievable in our lives. But look at this, 1926, no technology, no computers, none of those fascinating things. Yet people had this, vision or the imagination in healthcare that they could see or envisage in future that sometime in future this is going to happen, that doctors and patients would be able to connect remotely, not physically in person, through technology, whatever that technology is. So mHealth, we all know what mHealth is. There is no clear distinction or definition of mHealth, but we understand what that is. But we do know that mHealth has surpassed electricity as the most pervasive technology. It's huge. We heard the numbers in the morning session. Amazing numbers, keep changing. You know, the numbers are constantly changing and amazing us. So what was impossible before is now impossible, as we call it. So I'm in Istanbul, I have a patient in New York. I can actually see my patient from my iPhone through video conferencing and check his EMR from one app, and there are like 20, 25 apps available, maybe more on my mobile. So this is how possible healthcare has become. So now I'll move towards the application side. I have around 10 minutes. And most of our friends are from the pharmaceutical. So I want you to look at this opportunity of physician-patient pharma engagement. It has gone to a new level because of the so many factors I showed to you. So we are now looking at pharma-physician engagement, which is efficient, which is engaging, and which is effective. So the tipping point in social media is also there. Recently, FDA, that was the biggest concern for pharmaceuticals. Recently, FDA released its draft guidance on the use of interactive promotional media. So things are moving forward. Let us get ready for that. Look at the IMS Institute. I'm sure you all are aware of this institute. Engaging patients through social media. Is healthcare ready for empowered and digitally demanding patients? Pharmaceuticals and IMS and other industry partners are actually looking at this very seriously. So I borrowed some slides from my friends. Look at the anatomy. It's not only the millennials, but the baby boomers, every level of age bracket, they are ready, they're already digital. So it's not limited to one area. So today's digital patient is ready, it's empowered, is well informed. We have all these statistics on the internet. We're just trying to connect the dots and make sense from all this information. Accepting, we are embracing mHealth, and we want to stay connected, whether it's before the visit or after the visit. Next, patient portals are the next level of care. And if you want to invest your time as a pharmaceutical company or a hospital for that matter, invest in this area. This is going to give you not only engaged consumers, if you may want to call them, but a golden data, and that's going to help you. 85% of pharma executives believe that focusing on the patient is key to their company's profitability. And we have recently launched a program in Pakistan and UAE where we are actually training pharmaceutical companies on this area. How patient-centric healthcare, how patient focus can help to increase your ROI. So the pharma trends, companies are investing a lot in this area. Around 7-8 years ago, I was in Germany in a conference, and pretty much every major pharmaceutical company had its senior-most people in that conference looking at different, and that's where I got to know about doctors.net.uk before it was acquired. And so we are all in this learning curve. 42% of online consumers are also ready. Think pharma companies should be involved in online health communities. So the barriers are breaking already. It's not that the consumers or the patients are saying, no, we don't want to listen to the pharma. No. Mobile health market is growing. More people with chronic disease would accept a new app. So now physicians are actually prescribing not only drugs, but they're actually prescribing mobile apps. This is already happening. 500 million people will be using healthcare mobile applications in 2015. And I would just like to request you to just remember all these projections. Just remember these projections which we are making in healthcare. Diabetes, obviously, diabetes management apps are among the most preferred for patients. So if a pharmaceutical company wishes to involve in one, this is one area where you will get good engagement. Healthcare, physicians are already ready. They are waiting for telecom operators and pharma industry and hospitals to come up with solutions which are based on the healthcare needs, not technology based only. So provider trends, 60% want to communicate with the company. The physicians are ready to communicate with you through technology, whether it's online, whether it's e-detailing. 74% are willing to provide their input to you as well. And 89% are very interested in virtual collaboration tools. I'll be quick because I have 5 minutes. And I will focus on a few. 58% become frustrated due to lack of access. What I'm trying to say is doctors are actually waiting. They are ready with all their control, with all their codes, hands and everything, but still they want you to come up with some kind of solution as long as it understands their mindset, it addresses their challenges and needs. Don't, give them something which is not need-based. 84% of physicians say the internet is essential to their professional practice. They're already, Lens showed you so many social networks. Doctors are online. Doctors are ready. Physicians, they're waiting, as I said. The mHealth market will grow to be worth $26 billion by 2017. Another projection which I want you to remember. So these were the 14 categories given by WHO in its global survey of mHealth services, and the top 4 I've mentioned: health call centers across the 114 countries the survey was done, was number 1, health call centers, then toll-free, and the last was decision support systems. So these are the areas. Global fitness and health app trends, again a projection. By 2018 there will be 96 million users of app, again a projection which I think and I believe are all going to be proved wrong. These are the top areas. If you're looking at developing mobile apps, focus on these 3 areas. It has been proven in the world that these are the top areas where you need to invest in developing mobile apps. Look at this. So it has to be around the SMAC technology, as you call it: social, mobile, analytics, and cloud. Analytics is where the big data comes in, and that's an opportunity. Do not miss that opportunity. And if you look at the e-detailing solution, I think the data analysis is there. So let's come to my area, telemedicine. I've been in this space for 19 years now. I stopped my practice and entered into telemedicine because I wanted to help 180 million people of Pakistan as opposed to the 20 or 30 in my clinic. Now we have 200 million. So now again, more than half of all US hospitals. Telemedicine has come a long ways now. The last mile issue has been addressed, and we now have solutions in the US and in the West, and even in Pakistan, India, and African countries. We are using a lot of telemedicine. So the technology is available, the readiness is there, patients are ready, patients are finding it very useful. They would rather stay at home, have the consultation, because 70 to 80% of consultations, especially the follow-ups, are actually, they do not require the patient to be in the presence of the physician. So these are the stats which support telemedicine. This is what we're actually doing right now. We have these apps available. We have the hub and spoke model, the doctor-patient, the clinic-to-doctor. All of these are working. We have all these gadgets everywhere in the world. I mean, we all know, I was at the launch of this particular innovative product so many years ago in the US. Just a few ideas for you guys to take back. This is a very powerful way of engaging with not only with your physicians, by the way, but with patients. So for example, and no royalty in this idea. So you guys can, just go ahead and just get this on the ground. Simple, screens, put them up in your clinics, in your list of doctors, maybe 50 cardiologists, create the content, have them use the content for their patient education, and then you can do surveys, you can do, ECMEs through that. So not only you engage with your physicians, but you actually engage with your patients, and there are printouts to be made. It's a very a good model. We've done it, and I've seen a few good success models in the West as well. E-detailing, I'm sure you already are doing it, but don't ignore the analytical side of e-detailing, please. That's So healthcare online video adoption. We all know that we are moving to video. I told you at the outset, video is the future. And videos of clinicians, videos of patients, testimonials, we are going to have more and more video portals in the future. Webinars, so we have also developed something through which we want to collaborate, not only with physicians, but have a webinar, do some ECME, and connect with the patients. Learning management systems, these are the areas where you can invest. We've already spoken about mobile health apps. Just one example, obviously. I've selected a few examples. Dosage reminders, patient adherence is a major problem, as we all know that. A transplant patient who, before transplant, had lost it, right? If the patient does not get the transplant, he or she is going to die. It has been estimated that 1 out of 4 post-transplant patients, not a regular hypertensive patient, a post-transplant patient does not comply to his medication. So not only we are having a disease burden, but the pharmaceutical industry is also losing, because you guys convince the doctors, they write the prescription, but the prescription is not going ahead. So you're losing money, and we are actually having a disease burden which is adding to the system more. Portals, I've told you about that. Devices, wearable devices, look at the insidables, follow that very strong. So this was the model, and I'm going to leave you with this. So the opportunity is actually around these 4 areas. The first, which I've elaborated, is empowered patients, patient-centric healthcare, and patient safety. So you can develop an app for reports, incident reporting app. We are already working on it. I'm working with a study with the Imperial College London, where we are developing a study plus an app and looking at how we can create a robust incident reporting program. Digital HCPs, like I said, healthcare professionals, not only physicians, nurses, paramedics, everyone who's involved in this process is ready. They already have a smartphone, they already have internet, they're just waiting for a program. Non-communicable disease brings a tremendous opportunity of engagement. And the technology which is actually ahead of us. In my 19 years of working in this space, I started at scratch. There were very few people at that time in the world, and that's why we know each other. 19, 20 years ago, people used to make fun of us. Just get off, what telemedicine. But in the last 19, 20 years, technology, I have felt, has always remained ahead of us. It was us, the healthcare professionals, who did not deploy or use or leverage upon the technology based on our needs. So technology still is ahead of us. Look at IBM Watson. IBM Watson was not developed for the healthcare. It was not developed for the healthcare by IBM, but now it's being used by healthcare. So technology is there. And my last, as I said, we have seen a lot of projections and predictions. But just look at this. The telephone, these are the, I just got it from the internet, so you guys can just go to internet and predictions going wrong. Just, it makes you feel how little do we know. And this is where I actually say at the end of the conference that we don't know what we don't know. Our projections, our predictions, our visions, as far as technology is concerned, have actually pretty much failed us. We have never been able to predict, and fortunately, I would say, fortunately we have been wrong, because the technology has always stayed ahead of us and given us opportunity. So with that, I would like to thank you again for the opportunity, and any questions I would love to answer.
Doktor Zakiuddin Ahmed'e bir sorunuz varsa tek bir soru alabiliriz. Len. Mikrofonu alabilir miyiz? Hızlıca.
It's coming.
It's coming.
As ever, great presentation. This year has been a lot of discussion about how the pharmaceutical industry can actually tap into patient wisdom. And one of the proposals that's been made by someone in the industry is to bring patients into pharmaceutical companies as full-time employees. And this started a major discussion on social media in the last few months. I've been part of that. Have you any thoughts on the pros and cons of that?
Yeah, thank you very much. I think that's a very important question, relevant to what I have shared. So it actually is about empowered patient. Acknowledging the power of the patient, that's one. As I showed you, Dave, he's not a physician, but Mayo has invited him into Mayo's system for a certain number of months, and he's going to teach or share his experience with these professors. So what's happening is that obviously these health portals have, so if we are developing a health portal like Patients Like Me, there are already patients on board. Going further, as you suggested, and being part of one pharma company as a consultant, not as a regular employee, I think that the patients would certainly add value from, I don't think that making them employees probably would make, would be the right thing, I don't know. But having them on board, having them during the planning process of all these projects, I think would certainly add value. And I would go to say that not only patients 100% number one, but even physicians and healthcare professionals. So if you are planning a project, have on the planning team some patients as a regular member of that program so that they could give you their feedback. As part of the company, as an employee, I really do not know right now.
Okay. Thank you very much.
Thank you.